It's really a pleasure to present our long-term follow-up phase 2 data on a combination of APR-246 or eprinetapop with azacitidine in p53 mutant MDS patients. This was actually a global collaboration between the US MDS Research Consortium and a parallel phase 2 trial that occurred in the GFM in France. Eprinetapop is a first-in-class p53 reactivator. So essentially, it can restore the wild-type function of mutant p53, although it has a number of important p53 independent activities, such as increasing reactive oxygen species and inducing ferroptosis, among others. And so we previously have published both phase 2 trials in JCO this past year, but this is the long-term follow-up of 100 patients in the combined cohort, really no unique safety data. We didn't want to just look at the quality of response, which overall 69% of patients responded, with 43% having a true complete remission rate and 40% of patients having p53 clearance. But we wanted to ask whether or not the quality of response and the clearance of p53 mutations further impact prognosis, and indeed they do. So patients who achieved a complete remission or serial p53 negativity had a significantly improved median overall survival. General patients that had MRD negativity, this was less than 0.1%, actually had a 2-year overall survival of 50%, which is quite unique. The standard outcomes to allogeneic transplant are quite poor in this patient group, and thus we really looked again at the quality of response. And what was noteworthy, particularly if you had a CR or achieved p53 clearance and went to transplant, we actually have a median overall survival that was not met and far better than all other subgroups. And this is really the first prospective trial to show benefit of transplant, particularly in the setting of p53 clearance. And although a phase 3 trial was negative, we hope these data may further shed light on how eprinetapop with azacitidine potentially could be pushed forward in patients with p53 mutant MDS.